everybody, good afternoon. We are outside again because it is nice and our schedule's all screwed up. So, small children interrupt. I apologize in advance. We're going to go at this really quick though. If you're watching on YouTube, hit the subscribe. If you're watching on Facebook, hit like, comment, whatever. And yeah, we'll get after it. So what is the biggest mistake in pregnancy? This is a loaded question, and depending on who you talk to, what answer you'll get. And a lot of that comes from their experiences, their past, their education, their research, whatever. It comes from a lot of their paradigm. But from my experience and my research in pregnancies and my life, honestly, there's three biggest mistakes, and they come in the form of poor nutrition, blanket medication, and your mindset. We've talked about poor nutrition before, so I'll let you go back, find that blog, find that video. It's called I'll link it because I don't remember, but it's in the blogs. If you're on our Facebook group, go back through their trainings. It's there as well. Poor nutrition is not just a calorie imbalance. It's an imbalance or deficiency in vitamins and minerals. Proper nutrition can prevent a lot of complications, especially in pregnancy, when things go very quickly because you have very high nutrient demands. The second one, medicine. Hear me out here. Number one, I'm not a doctor. Number two, do not stop taking your medication that has been prescribed without talking to your doctor and researching for yourself first. Okay? That said, a lot of medication that is thrown at pregnancy is really unneeded. That's not saying there are times it is needed. There are. But what I'm talking about is blanket policies saying just because you're pregnant, you should take this medication. A really good example, when I was pregnant with my son, I asked about preventing preeclampsia because I knew I'd had it before and I didn't want to go through it again and have those ramifications. So I was told, we're actually recommending every pregnant woman take a baby aspirin a day. I'm like, what? That doesn't make sense. Why? Why does it not make sense? Aspirin is a medication. It can hide a lot of the imbalances. Your body throws symptoms at you to say, hey, hello, there's an issue, you need to fix it. Sometimes that's pain, sometimes that's swelling, sometimes that's a headache, a rash. Something in your body is like, hello, I need a little help here, you need to fix this. That's what those are. Medications cover those symptoms up, okay? So by taking a baby aspirin a day, yeah, I'm keeping my blood pressure down chemically, but what was the reason my blood pressure was going up to begin with? What was the reason I was swelling to begin with? You have to dig down to the root cause. I've come to the conclusion just through my experiences with my daughter's pregnancy, with my son's pregnancy, the research I did during and between those two pregnancies, is that if you give your body what it needs to correct the imbalance itself, whether that's more protein, more magnesium, it's deficient in a certain vitamin or mineral, the body will fix itself. It's amazingly balanced, and it naturally wants to maintain the homeostasis, the natural balance of life. And it can heal itself if it's given what it needs soon enough. Okay, there are times it's not caught soon enough and you have to either take the medication or do the surgery to fix it. That's just the way it is. However, living this life without just popping the pill and taking your medication also requires more effort, which I'm okay doing because I don't like the side effects of the medications I've been on in the past. It's not ended well. I usually wind up sick. or have worse imbalances, or it's just not pretty. So I just don't take medications, especially when I know my body can fix itself. But to live this way, you have to dig down to the root cause. You have to find why that swelling started to begin with, or what was the cause of that headache. Instead of just taking the aspirin, did I eat something that's not agreeing with me? Was I around something toxic or am I on caffeine withdrawal? It requires more effort, but it's worth it. Finally, mindset. This is a very loaded topic as well. And I'll be completely honest and upfront, I'm still working on it. It's a continual growth process. And it's huge. But mindset has a huge effect on our overall well-being. Our mind has a lot of control up here. What our mind says, thinks, and feels has a lot of control over what the rest of our body does. Okay? For example, a good example of this is if you feel threatened, we'll just go with birth, right? Somebody walks into the room that has been completely peaceful, and all of a sudden you feel threatened. Your innate spidey senses, whatever, go off and go, something's not right here, hello, I'm not comfortable anymore. What happens? Birth stops. Unless you are at the point, and even then, sometimes it will stop, of like crowning, birth can stall or stop at any point. I've actually heard of it stopping when baby is like just ready to crown too. And it was something as simple as a mindset shift to kick that labor back into go. Whether it was helping mom feel safe again, or mom's mindset just needing to overcome some sort of emotion. Okay? As far as the pregnancy side of this goes, our society has put so many stereotypes on pregnancy and birth. And we willingly buy into it. I did. My first pregnancy with my daughter, second actually, with my daughter, I was terrified. I did not feel good. I was anxious. I was terrified of birth. Okay? I worked through a lot of that, and it still didn't go the way I wanted, but whatever. Society tells us our pregnancy is supposed to be uncomfortable and birth is supposed to be painful. That's not necessarily so. Yes, there are parts of pregnancy that are going to be uncomfortable, but how you look at those determines how uncomfortable you really are with them. Yeah, buddy? Yeah, you got water, don't you? Your hands are all wet. A very simple way to start shifting your mindset and your view on pregnancy and birth is actually just changing your words. Both verbally, outspoken, and in your head. Okay? Because what you say in your head also affects what you say. Start by saying it out loud. If you catch yourself saying something, stop it, correct it. Catch yourself saying something in your mind that's not supportive, catch it, stop it, correct it. A very simple example of this, okay? We'll take the words contraction, okay? It sounds painful, it sounds harsh. Doesn't sound pleasant at all, right? What about a rush? That doesn't sound as bad. Now use it in a second sentence, and which picture of birth would you rather have? The contractions were intense, but manageable, or the rushes were intense, but manageable. Just changing that one word to something that is not as harsh sounding paints a totally different picture of birth. So, try that. And my challenge to you, either comment below in the video or on the blog, what are some other words that you can think of that you can change both in your pregnancy and birth that'll help shift that mindset to a more positive light? We'll catch you guys later.